Hey guys, my name's Ryan and I'm an Australian physiotherapist specializing in complex spinal conditions and athletic sporting injuries. And today we're going to be talking about disc bulges, disc protrusions, sciatica, and what to do about it. So why don't we start off with some simple anatomy first so you understand what's happening. So if I grab my model here, this is our lower back and technically our pelvis and our hips as well. Okay, so here in the lower back, what we've got is we've got each lumbar vertebrae. So that's each level of your lower back. And your lower back has 5. And they start from L1, L2, L3, L4, and L5. So in between your lumbar vertebrae, we have these things called your intervertebral discs, which is what we're talking about today. And the discs are really there to design to absorb load and distribute forces evenly across your lower back. Now, one of the main mechanisms that we think causes disc injuries like bulges and protrusions is that repeated exposure to flexion-based activities, which include sitting, could potentially weaken structures in the disc or weaken the outer ring of the disc. One thing to note here is that most disc injuries don't happen overnight and they've developed over a period of time. So it's not like you go to the movies, you sit down for 2 hours, and tomorrow you wake up with a disc bulge. Like, it doesn't really work like that. It's built up over a time through exposure or repeated exposure to certain activities like sitting, or it could be the sport that you play. Whatever activity it was that was straining your disc, it was happening over time. So let's take sitting, for example. If you've been sitting 8 hours a day, 5 days a week for 10, 15 years, that's a lot of force going through your back. So what the effect of sitting has is that it tends to weaken the annulus fibrosus, which is the outer ring in your disc. Over time, what happens is when the annulus fibrosus gets weaker, the disc material has a bit more potential or risk of exiting or protruding outside of the normal boundaries of where the disc should be. And I'll show you what that looks like here on the model. So here we have that same model of your lower back. And these yellow things, these are your nerves, by the way. This thing here, this red thing, this is actually a disc protrusion. So here's your intervertebral disc. And this red thing here actually shows part of the disc material is actually protruded outside of the normal boundary of where the disc should be. And so if we look a little bit closely, this protrusion out here, we call it like a lateral protrusion. It's actually pinching on this yellow thing here, which is your nerve. And that can give you symptoms which you would know as sciatica. It's also important to know that not all disc protrusions will give you sciatica. It's more along a continuum. So on the very mild end, it might just give you some very localized lower back pain that typically travels horizontally across your lower back, or it could progress to something a little bit more severe where you will get that referred pain down the leg, and we call that sciatica. And progressing all the way to the very severe end, you could have what we call a radiculopathy, which is where you'll get the pain, you'll get weakness, you'll get tingling, pins and needles, sharp shooting pain, maybe even the loss of some reflexes in your lower leg. So disc protrusions can be mild, they can be moderate, they can be severe, and you'll get different symptoms depending on how bad your injury is. The good news is most injuries involving disc protrusions like sciatica and your radiculopathies can and should be managed conservatively. And what we mean by that is that you do not need surgery for most disc protrusions. So when I'm managing somebody with disc protrusions or sciatica type symptoms, what I'm really trying to assess in the beginning is to see how much pain they're in, how much movement they've got, what is their neurological status, and that means how much of their nerve is involved, if it is involved, to figure out what is the best plan and course of action for them. If they're a really acute presentation or a very recent presentation, they're probably in quite a high level of pain. And so a lot of the treatment that I'll be doing is some hands-on work like joint mobilizations, muscle release techniques, and a lot of dry needling. However, the focus for long-term solutions will always be on addressing the contributing factors to why they developed their condition in the first place. It could be things like weak spinal extensors, maybe poor engagement in their core, or just a lack of activity or mobility in general. So I need to figure out what is it that actually has contributed to this person developing that disc protrusion in the first place. And my main focus should really be on addressing those factors to ensure that the condition has a really good long-term result. A key muscle group that I really like to focus on, especially in people with chronic lower back pain and chronic disc issues, is the spinal extensors. And I'm going to put up an MRI over here. And what it shows is that in people with chronic disc pathology or chronic disc bulges, there tends to have some fatty infiltrate, which is shown in white, into the muscles surrounding the lower back. And that's not a good thing, because fatty infiltrate is inflammatory. And number two, the fatty infiltrate actually tends to inhibit, or it reduces how well the muscles can function. And that creates a vicious cycle, because when you have muscles that don't function well, it's not protecting or it's not supporting you well, which means that you won't be able to do the same level of activity as you used to be able to, or at least without it flaring up again. So what we want to do is to be targeting specific muscles in specific ways that doesn't flare up your condition, while still addressing key impairments that are common in people with chronic disc issues. So you've been dealing with a disc issue for a long time, including sciatica. Please go and seek a professional who can assess you well and create a program that's specific for you, addressing all your contributing factors. If you found that helpful, please consider sharing it with a friend and subscribing for more content just like this.